We can. Calling to order the public safety meeting of Tuesday, February 20th, 2024 at 5:30 in council chambers here. And on that, we will start with approval of minutes. Do I have a motion to approve the minutes of the meeting of January 16th, 2024?
Move to approve.
Second.
All in favor?
Aye.
Aye. Now, I'm going to make the meeting open to the public. If there are any public comments, please step up.
Rich Paulich, Palicio, 8 Washington Street, former chairperson of the Public Safety Committee, Rock Hill Town Council. Thank you, Mr. Chairperson, and members of the Public Safety Committee. This is probably, it's twice at the Public Safety and once at council level. In regards to the access to voting district number 2, the Mosher School, the access for people that are physically challenged and elderly people that have a difficult time walking. So I talked to the registrar of voters, and I agree with them that we can't move it to the town hall, the community center here, because there's just a lack of parking. So what we're going to have to figure something out, but I spoke with him, and these are, what I was thinking, that probably through the police department to move, not to move, but put up temporary handicap parking that lines up with the door that we have to enter to vote. Also, maybe discuss, a temporary ramp, some type of solution so the people can get over that hump there, to step up over the curb and onto the sidewalk to the entrance to the voting poll. Yeah, I think that's all I have, but like I discussed with you prior to the meeting, Mr. Chairperson, Fakash, before you know it, it'll be November in the presidential election. Of course, it's going to draw a lot more people, you would hope anyway. But yeah, let's, maybe discuss it with the engineering department, and they can put some temporary ramp, whatever they have the expertise. And the Joe Lentini from the Highway Department, Public Works. All right, thank you very much for your time.
No, thank you. Are there any other public comments from the floor or online? I don't think there are any online. Okay, so we'll move to department updates. We'll start with fire.
Thank you, sir. As you can see on the summary page, our information is there. Just a couple quick little highlights. We only had 4 I-91 calls in January. Very quiet month on the highway, thank God. However, February is making up for it with 13 so far, including 4 this past weekend. We had 1 injury in January, which was very minor, and that was just a jammed finger at a mutual aid structure fire in Weathersfield. For apparatus, currently Engine 1, which is housed right next door to us at Station 1, is out of service for engine work at Cummins Diesel. It's been off the line now for about 2 weeks, and we expect it back sometime next week. We promoted 1 member to training captain to put a little help into that area so that we can raise the bar with our training requirements. As part of our cancer prevention program, we inspected 8 sets of structural fire gear and decontaminated 28 air packs. About 50 of the packs were scheduled for decon, and the other half were because of a couple of exposures. With that said, after last week's structure fire at Forest Park, we decontaminated 18 more sets of gear and are in the process of decontaminating 18 more air packs, all due to the exposure. And if you'd like, I can just do a very quick review of that structure fire.
That'll be great.
Okay. Came in on Friday night at about 8:20, and it came in as smoke and fire showing with people screaming in the background. So right off the bat, you knew something was going on there. As we pulled up, we were informed of several missing people, an adult missing on the second floor and an infant missing on the first floor. Luckily, they had both, the adult self-evacuated, and the infant, who was in a car seat, was taken outside by a neighbor. So what we found was a room and contents fire in the first floor apartment, which was really pushing a lot of smoke throughout the rest of the structure. And it was extinguished in about 35, 40 minutes. And we brought the Red Cross in, and the Red Cross was able to house and support 5 families with a total of, when I say 7 adults and 5 children, a total of 12. And as of when we left, there were 8 apartments that were not tenable. So a lot of work that has to be done. When I talked to the building management a few days later, they were checking the apartments for asbestos contamination, and I haven't heard back since then. And I stand by for questions on the fire side.
Councilor O'Sullivan.
Yes, thanks. So, Chief, with respect to that structure fire, do you have any report on how the building infrastructure performed in terms of whether it was common area smoke detectors, sprinklers, fire doors, that sort of thing?
That's a great question. That building is not equipped with sprinklers. There were smoke detectors activated. When we got there, we could hear them. So the early warning devices were working. And the exit signs in the hallways were working. And when we killed power to the building, the emergency lighting up the exits was working. It also held the fire to that one apartment.
So the other apartments that are uninhabitable, that's mostly smoke damage?
Smoke damage, yes, sir.
Okay. Okay, thank you.
Any questions?
No question.
Councilor Whelan?
Thank you, guys.
Chief, what were the 2 drone activations were about in the summary? You have 2 drone activations. So I'm moving on from Fall Street.
Okay. I believe they were to support the accident reconstruction team. I don't have the details to where's and the whens and the times, and I can provide them if
No,
you'd like.
I was just curious because when those are activated, there must be like a bigger picture event, right?
Yes.
Yes. Okay. So, what about the I-91? 4 incidents there. So $6,000 for this month, the January month?
Yes.
Okay. And then $83,000 for the fiscal year?
Yes, sir.
Okay. And when does the fiscal year end for this?
That same as the town fiscal year.
Okay. All right. That's all I got. Thank you, Chief.
All righty.
So moving on to emergency management. It's Chief
Okay.
Gary.
Okay. January, we had a busy month with emergency management. We prepped and tracked several storms, including the rain event, which occurred right after a snowstorm. Much time was spent proactively working with the highway department to ensure that all the drainage was open and not snowbound. We wanted to ensure that the streets drained properly, and kudos to Joe Lentini's team and Tom Bogus. They went out there and made sure it was all perfect and we had no issues. We also participated in Eversource training for storm management. We also participated in a training session followed by a tabletop exercise put on by State Department of Emergency Management for Operation Migrant Worker. Lastly, we continued to outfit the town's Emergency Operations Center this month, or January, the Facilities Department outfitted the space with cable drops and power for 4 computer stations and monitors. The monitors are in. They're being mounted this week, and we should have that part up and running. So we are moving forward with that.
Excellent. Any questions, Councilor Sullivan?
None of this stuff. Thank you.
Councilor Whelan?
No question.
Can you go into a little bit more detail, Chief, about this tabletop exercise for the Operation Migrant Worker? What does that entail, and what is that about?
With the influx of the migrants heading, we've seen an influx in some of the state towns, mainly Greenwich, Stamford area, and it's overwhelmed some of the town resources. So they've been spreading out people, and they wanted to prepare all towns, what you may see as people are bused from Texas up around to this area. There are no plans. There's nothing on the radar screen at this point. However, they just wanted everybody to know that the state's involved, state DPH is involved, and there's numerous agencies who continue to meet to prepare sites and to welcome people when they come in. And that was pretty much it. If Rocky Hill does get involved, it will be the state reaching out to some of the local hotels and seeing what's available for rooms, and then securing the rooms and establishing payments through there.
So I would assume that town manager will have a role in that if that comes to fruition ever.
Imagine so.
Okay. But nothing, no action items as of now,
No.
anything? Okay. Great. Thank you, Chief. Madam Mayor, do you have any questions for the chief, either regarding fire or emergency management, since you are here?
Thank you. Just to let you know that when I was at the CCM legislative policy meeting, they had all kinds of lawmakers there, and I mentioned what you had said about there being a recruitment grant back in the day, and they were kind of not really up to date with that. So they're going to look into it. So hopefully, it seems like a simple solution. A while ago, there was a recruitment grant, and once a year, the chief had explained that there was a statewide recruitment day.
The recruitment grant came through the Connecticut Fire Chiefs Association, and we applied with the assistance of the International Fire Chiefs Association, which is based in Virginia. And what they did, they tried to standardize everything, and they had one big recruitment day followed by little workshops or little open houses. However, by putting all the advertising or creating that day, everybody got the same amount of advertising. It was a general advertising. They went on the radio streaming channels, television, social media. They had media consultants. It was great. We picked up, I want to say, about a dozen people right off the bat. And that's just something that's beyond our capabilities of doing, something on that level. So hopefully we
They're
can
going
revive
to take a look
that.
at it. We'll try to, yeah, that's all.
Anything on emergency management?
Nope.
Okay, thank you. Moving on to ambulance report, starting with the Rocky Hill Volunteers.
For January, we had a total of 117 calls. The types of calls, the primary types of calls we have, and I know I talked about this in the past with respect to trends, falls. Keep in mind, we do have an aging population, and especially in the winter, it doesn't matter how old you are, especially when it's icy. So falls are a big deal. COVID, the flu, RSV, so respiratory illnesses are up. General 6-person calls. A lot of medical alarms or medical evaluations. Oftentimes, those result in refused transports. It could be an accidental activation or a medical alarm or a medical evaluation. You know, they may go to their own doctor or may transport, with family members. One cardiac arrest. in January, 1 opioid-related encounter. Staffing, 49 active, 3 probationary, 5 associate, and 1 on leave of absence. You should be aware that there are new EMS protocols, and our members have been working with Hartford Healthcare and OEMS as far as updated training. And there is a course you take, there's a brief quiz afterwards, and then it's up to the agencies to decide if they're going to be doing certain training sessions to comply with certain updated protocols, whether it be injectable medications or, assisting patients with other intranasal type medications. We took possession of a new ambulance paid for by Rocky Hill Volunteer Ambulance Funds, Ambulance 371. So that's in the setup process with respect to registration, setup with equipment, and state inspection. So we're in the process of doing that as well. So,
Perfect. Thank you.
I don't know if Cheryl Buckley is with me this evening. She's the Assistant Chief of Admin, and I don't know if you have any.
Just that other topics covered for training were pediatric emergencies. Obviously, we'll be coming up to that time, getting to spring, as well as upcoming will be diabetic emergencies, and the biggest topic, all is GLP-1s, which is the Ozempic, and Mounjaro and Trulicity are the biggest ones that we're seeing in side effects and resulting in ambulance calls as well.
Any questions, Councilor Sullivan?
Can you elaborate on that? I hear a lot about Ozempic, but I hadn't heard about Ozempic creating side effects that were driving up ambulance calls. Can you tell us a little bit more about that?
Yep. So what happens, so one of the main things that it does is slow down your digestive tract. So what we're doing is having people with constipation issues, general GI issues. It can give you nausea, vomiting, diarrhea, but it can also give you severe constipation leading into small bowel obstructions. So we're seeing it I work in a primary care doctor's office, so not only are we seeing it, but all over. General communities are seeing it here in Connecticut, as well as across the nation.
And how does that generate an emergency type situation that'll prompt a 911 call versus, calling your doctor?
Well, we have had a bowel movement in about 4 or 5 days. A lot of times they'll call us versus going by car, especially your older population. Everybody wants Ozempic because it's like the magic cure. But as soon as you stop it, you gain all the weight back that you've lost. So.
Okay. No magic bullet yet.
No, I wish.
Any questions, Councilor Whelan?
No questions. Thanks for your service.
Madam Mayor, do you have any questions?
Are we going on the other slides?
Yeah, we will go to Dave after this.
No,
if you
no,
wanna-
I mean with ambulance. I do have some questions.
Yeah, so go ahead.
Okay.
This is a great time.
Okay, thank you. So the 117 calls, do you break those down into hot versus cold calls?
I don't know that these slides have, we can do that. We can do that for you if that's something
Just curious.
you want to do. Yeah, we can do that.
And then the new ambulance nearing completion, that's 371? Is that a fourth one? Or is it a fourth one? So,
No, we have a 370. Our call letters, our call numbers are 370, 371, 372. So we have a brand-new ambulance. That was 370. That was picked up last year. We have 371, which will replace an old 371 that, once it's geared up and inspected by the state, that will replace that vehicle.
okay. And then the Intercept, is that also called the
That's
Is it-
the medic.
is it a fly car?
Medic
is that called
5.
Okay, yeah, all right.
Medic 5 vehicle.
Okay.
And that is used by, we have the basic license, Rocky Hill Ambulance holds the basic license for the town, as well as the paramedic license for the town. And we, as the town, contract with Aetna to provide paramedic services. And that fly car is purchased by Rocky Hill Volunteer Ambulance, Rocky Hill EMS, and it's used by Aetna medics when they're on duty in town.
And so what are you waiting, what kind of approval do you need to get that on the road? It says you need some type of approval. Oh, your backup
No, this
unit.
is the 371. 371.
Under paramedic intercept, it says
We
paramedic.
we have one that's been licensed as a paramedic intercept.
Yeah.
And we have the original one that had a blown engine, and that needs to be inspected for
Okay.
paramedic use.
All right. And then I just have recruitment and retention only because on the Public Safety Committee that I sit on at CCM, recruitment and retention is the number one issue. So that's what they're lobbying state lawmakers for during this short session this year. So any information that you think would be helpful for me to bring back, doesn't have to be in this meeting, but let me know and I can bring that back to CCM because we're putting together our legislative recommendations now.
I will be sending you an email.
Okay. And then along the lines of recruitment and retention, can you just explain, is the active members, is that your catch-all membership? Like, what is
That would be everybody.
everybody that's on?
And then underneath it, you have 5 of them are associate members.
Mm-hmm.
1 is on a leave. 3 are probationary.
So what is a
We just
def?
recently cleared 1 person, so they just moved up to active.
And what is the definition of associate member? Is that an EMT?
Actually, I believe one of them, Chip, I believe is.
Yeah, Chip was.
So we still have associate members that may be EMTs, but not necessarily riding.
How
They
many?
may be helping out in other ways, whether
Okay.
they be office personnel or events. We participate in a slew of events, whether it be trunk or treats or touch a truck.
The fairs, yeah, you do, yeah.
So we do a lot of that, and they may help out in those events.
So what is the distinction between an EMT and a writing person?
That you may be one and the same.
Okay.
You
So-
have to be certified as an emergency medical technician in order to ride on the ambulance.
Okay.
Yes.
And then-
Unless
so-
you're observing.
Okay. And then how many EMTs do you currently have?
I'd say we have the 49.
So I have it on the.
49 plus 3, plus maybe 1 with, I don't have my list with me.
Can I ask a clarification question, Madam Mayor? Like, what is the active member versus the writing member? Is that the same thing?
Yes.
Okay, thank you.
Correct.
So in this membership breakdown, can you break it down to show how many are EMTs?
Yes, because outside, the probationary members are EMTs that just haven't, they're coming in, they're training with respect to our policies, procedures, and then once they get cleared, then they will become a full writing member.
Right, but we know that
But
of your
the- but
active
the-
members, 49, those are not all writing members. I'm just trying to figure out how many writing members you have, that's all.
Yeah, because you have, technically, the probationary members are writing members also.
All right, so I see 3.
So minus the 5 plus the 1.
But if you have people who are administrators, office staff,
Yeah,
people
that's-
washing the
that's their
car,
associate
they're
member.
also EMTs?
No, we have 1 that's an associate member that happens.
So maybe just next time, can we make a chart that shows EMTs and then what, other non-EMT roles?
Certainly, certainly.
And I'm asking because, again, I want to bring back the information, and when I look on the website, in which I don't know, that we probably need to update, I'm thinking now, it says we have 63 active writing members, which I presume means EMTs.
That hasn't been updated.
Okay. And then on your page, it says there's 73 EMTs, which looks like it was updated during COVID because it mentions your COVID response at that time. And so I'm just wondering, how many have we lost? Did we start at 73 EMTs during COVID, and are we down now to some number below 49?
You should also know that many of our members are in college. Many of our members ride during breaks, during the summers. Once they become doctors, once they become psychologists, we have a lot of people that have moved on to becoming doctors and nurses, travel nurses. Then they're off of our roster, or they come back seasonally. They come back, I'm a travel nurse, I'm gone for 13 weeks, I come back for 2 weeks. I'm gone for 13 weeks, I come back for 2 weeks. And they ride during those 2 weeks. So, I mean, I don't know if you want to break down.
Well, I'm just wondering for purposes of recruitment, when we try to get a handle on what that looks like, if we had a number that that you can rely, I don't know how you I don't want to categorize it for you, whether they're full-time, part-time, seasonal, so you know what your base is of EMTs, right, through each season, so you know how many you have to have on staff, presumably for a municipality of 21,000, which I don't know. Is there a number for that? Or no?
Keep in mind, we are a community-based volunteer nonprofit organization. So our staffing, obviously, it fluctuates. There was 1 year, I don't remember when it was, but 1 year we had 24 probationary members all at one time.
Wow.
This was way before COVID, when I think I first started out.
We lost a lot during COVID. A lot of people chose not to ride.
Because they were afraid. And
Sure.
I kind of don't blame them. It was scary.
Yeah.
But there was a time, like I said, we had 24 people, and then COVID hit, and boom, change. We do have an EMT class coming up again in February. We do have a few new applications. One is an EMT student, one is a certified EMT, and 2 are interested. I believe there's 2 interested in taking an EMT class. So they come in sporadically.
Yeah.
But this is how it is. I mean, most people grew up wanting to be a firefighter. I did not, because I have a death fear of it, so I'm glad you can do it. I won't do it. But a lot of people don't grow up saying, oh, my God, I want to be an EMT. They might grow up and say, gee, I want to be a doctor. And we get those people because they need patient contacts, and we welcome those people. We welcome those people. So.
Madam
So
Mayor?
it's based, it's based, so I get it. So it's good feedback. So it's voluntary, it fluctuates, it's not like a career choice. So all of those factors come into play,
But
yeah.
I'll see what I can do for a breakdown for you.
Yeah, that's what I was going to ask, actually. I was just trying to bring
Yeah.
it together. So, Madam Mayor, would you like to see a breakdown of all the personnel? Because I have the page here, so essentially there's like 49 active members, probationary 3, we have a list here. But I think if you want to break it down even further a little bit, or maybe even seasonally, whatever you can do, right? I mean, we can just take it as a
Yeah.
takeaway, essentially. And we'll go from there, so.
Yeah, and then it helps, when we have our bigger meetings with municipalities to say, Rocky Hill is down this amount in comparison to other towns who have volunteer agencies, and figure out ways to get the state to help us.
Sure. I would like to go to the town manager. I think he has a question.
Yeah, I was just curious. I know I asked the fire chief a while back, is there a number that you need to properly serve the community? And you gave me a number. Is there the same thing for the ambulance? Or I think it goes back to recruitment. How do you know we need a recruitment?
So you are saying what is the minimum viable number
Is there?
to serve a town of the size of our community,
Yeah.
like 20,000?
Yeah,
Let's
if
just think
there
about
is one or not, because you fluctuate from 49 to 65. Is there something that you really want to, is there a level you need for proper coverage? I don't know if there's an answer or not.
Well, keep in mind, we do contract with, as is the town involved, contracting with Aetna, which is a commercial service, which is a big regional business, not a community-based, community-serving service. I mean, they do serve our community as a contract vendor. We have and hope to get more people through our classes and through talking with recently certified EMTs also to be able to staff. It would be nice to staff 2 ambulances during the time we volunteer, which is 6 p.m. to 6 a.m. during the week and 24 hours on the weekend, backed up by Aetna.
So do you know what kind of staff levels you need for that?
Off the top of my head, I do not. We'll get that for you.
I don't
I think I
next meeting.
understood there was some type of federal regulation that recommends minimum staffing requirements. I don't know that it's mandated, right? But I think there is some type of recommendation.
So,
Kind of like with police, right? Yeah.
so that's a great point, right? And I was thinking there is a segue here actually because Dave has been trying to get into the conversation. No, that's totally fine because he can probably shed some light on these things if you can, but also if you can summarize your report for tonight at the same time.
And know,
Yeah.
and know that we, I know there was a time when Rocky Hill Ambulance was using a combination of Medic 5 with Aetna and one of our members as a crew. That hasn't happened in ages. That hasn't happened in a long time now. So we always have a crew
Sure. Yeah.
available. So.
No.
Can I pose one question to Kim?
Yes.
This is something that slipped my mind I meant to ask previously. So Kim, this is anecdotal, just in conversation with somebody, and this is not about Rock Hill, but a nearby town, a story about someone had to wait 20 minutes for a response on a 911 call because, quote, both of the ambulances were being used elsewhere. And I thought that doesn't sound right. I mean, in Rocky Hill, do we not have kind of a rollover to Aetna or on a regional basis?
That's how it
In
does.
that type of situation?
And I know that Dave can explain that more, easier than I. But Aetna, we and Rocky Hill contract with Aetna for paramedic services. What happens is, as Rocky Hill goes out on a call, there's an ambulance, an Aetna ambulance, if we don't have a second crew on, that is staging typically on the Rocky Hill-Weathersfield line to respond to either Weathersfield or Rocky Hill. They will take the next call out. If we then, in Rocky Hill, clear our call, then we're up next.
Right.
Or if we get another crew on, they're up next. So, but it's cyclical.
And if you need
And
that
then
third one, I mean, does it keep kind of
Oh, yeah,
cascading
and
that
it
way?
goes to another business, and it keeps going and going and going. And if there's a mass casualty incident, and I know the chief is really well versed with this, but there's a mass casualty incident, we all kind of report to what I call the air traffic controller of ambulances in this area, the CMAD, and they know where we are. We have to radio in when we respond to a scene. We have to radio in when we're at a hospital and when we're leaving the hospital. So they know where EMS units are, whether you're a professional, commercial business, whether you're a volunteer, a community service-based business, they know where you are. So there's always someone that will respond.
Good to know. Thank you, Kim.
Dave, you want to step up the podium and then if you can answer some of those questions, if you have any answers, that would be fantastic.
Yeah, no, those were some good questions, actually. Let me try to unpack some of that. Okay. First question that which one do you want answered first? And I'll go from there, because I was trying to keep track of them in my head, and I should have been taking notes.
Let's do the EMT pieces first. Like, is there a minimum requirement, staffing requirement?
Sure.
Let's go there first. And then we'll go to Bill's question, because that also, we
Yes,
talked
they're
about
all
it before.
tying in, and they were all really good questions. They're all related. So as far as the question of, is there a minimum ambulance requirement from the federal government? No. State of Connecticut really puts that onus on the towns to decide what is necessary. So back in the early 2000s, they passed regulations basically say, hey, towns, which actually the emergency manager, Chief Gary, I believe, wrote it most recently, you need to come up with an EMS plan that kind of encompasses everything that you were talking about, which includes, what are our expectations for our town for the first 911 call, the second, the third, the fourth, the fifth? And what are our expectations when there's a mass casualty incident, which is defined as, more resources than you can handle within 15 minutes, right? There's surges and there's other things that happen, but a mass casualty incident in one scene where there's just a lot of stuff, and it really puts it on the towns to take ownership of that and kind of take control of it. So there's no real number per se, right? And I actually have been working on this question because that question gets asked not just here but in other towns. They're like, what is the answer? And so I actually kind of broke that down on some numbers. And we'll get into that when I do my report here in a little bit on how many ambulances go active at one time in the town of Rocky Hill. So that was that one. And then your question, as far as refilling, we're a little unique. Town of Rocky Hill and our coverage areas are unique because we abut all of them, right? So what we will do is, if we hear a 911 call go out, our dispatch center will automatically, whether we're covering for the Medic 5 shift or covering for an ambulance, we will move a resource into the area, whether that's covering the town as a whole, because a lot of times we have enough resources to just dedicate one ambulance into the town, or sitting on kind of a line where they're on Rocky Hill, Weathersfield, and whichever town asks first will go to it. It's not unheard of for there to be a 20-minute response time. It is probably the rarity in our area. I can say that less than, I think so far this year, we've only passed one call to an outside provider, which is really our sister company, which the dirty little secret there is, and this is what makes Aetna kind of cool, is we tell them beforehand, before the 911 call comes in, hey, we're out of resources, can you shift somebody over to our area? And they will shift somebody over before the 911 call comes over. So you're not waiting for a truck to come from Manchester to get to Rocky Hill. They're already on that kind of transit. Senator Anwar from South Windsor has been very vocal about these EMS deserts, and particularly in the northwest and the southeast portions of the state that are a little more exposed and a little more dependent on smaller services, they are going 20 to 30 minutes without a response. And the average response times has been very high. And that has kind of been the focus, and I think that what you're really hitting on, this kind of this recruitment and retention thing, we got to find an answer to it, because right now our system in some places is very broken, and it's gotten to crisis levels. It's fortunate that's not here, but it is something at least be peripherally aware of, that is a real thing that can happen here very rarely, but it is a thing. So hopefully that answered those two questions at least.
Any follow-up, Councilor Sullivan? No, thank you. Madam Mayor, do you have any follow-ups?
Yeah, I'm just wondering though, how does each individual municipality become solely responsible for determining how many ambulances they need? Does DEMIS get involved in that? And do you meet with other municipalities so you're not like out in left field?
Right. So it's kind of odd, you would think, yes, that would be the case. They do really suggest working alongside the fire departments, police departments, and other resources to kind of help determine what that's going to be. For the most part, though, it's really heavily dependent on that EMS plan. Some places don't have one, which we're working through that. But there's really not a mechanism, right, to say how many do you need, other than just kind of looking at the data, which I'm trying to kind of better understand.
So like historical data?
Yeah, so like historical, looking back to
see.
see, hey, where are we at with, how many units are going active at one time. And it's hard because you can't compare, just using the population is not necessarily a great metric, because, Town of Rocky Hill has a very, we have 5 very, very large skilled nursing facilities, or elderly care facilities and assisted livings. And that drives call volume up. You also have Interstate 91 that also brings in calls. So comparing yourself to, another, and I can't think of one off the top of my head, but, another 20,000, population town may not have all the same qualities that the town of Rocky Hill does. And a great example actually is like New Britain. The city of New Britain does about 17,500 911s, which is crazy. They do that with 4 ambulances, right? But they also have a hospital in their backyard, so they can whoop whoop whoop, turn around, go back out. And I used to work for them, and it was, and that was cool back then when I was younger and had more spunk and energy in me. I could do that, but you couldn't compare them to somebody else who was 80,000 and say for sure that it would be 17,500. There's a lot of just multivariable things that kind of go into that to say what that number is. So you kind of have to evaluate.
Yeah, so how do we get to that? That's the question, really, because I want to get somewhere here, because I think this discussion is great, but...
And that's where and so I guess because we're talking about it, I'll skip to it. So on, I think it's like page 5 or 6, I started to break it down. And I broke it down into percentages. So it's on the unit response and nature of calls section. So what that is talking about, and I can't really use the data. Granted, I have most of the data for the daytimes, and that's when you're going to see the most unit requests simultaneously. So what it's looking at is it's saying, hey, how many times within 1 hour, so say if there's a call at 14:02, by 15:02, how many 911 requests were in that same hour time frame. And so you can see, like, for the most part, you know, there's very few instances where there's more than 4 ambulance requests in an hour's time frame for, you know, requests for an ambulance service. But it does happen. So, you know, you have to prepare for it. You got to say, okay, what is it that, you know, where are we capturing the most amount, you know, for what we're getting into? So, you know, 2 looks like it captures about almost 80% of that call volume. So 2 ambulances could probably get that done. It doesn't equate like turnaround time of the hospitals and all that, but that's just how many requests are coming in. So this is my first kind of stab at trying to understand what is it to answer that question.
So can we do a follow-up on, like, we have 2 follow-ups now. So first follow-up is with Kim, and then the second follow-up with you. If you can take a stab at it,
Yeah,
you
sure.
don't have to, like, you know, we wouldn't, like, you know, insist on it if you can't get there. But I think if you can make a much more of a, let's put it this way, a good faith attempt to do it, like, in a way where, like, it's even a reasonable estimation, I guess. I would put it that way, right? That would be fair, I think. Like, if it is an estimation, we can clearly mark it as an estimation, not like a
Right.
real forecast. But if we can try that, that'll be great. Like, you can go through the town manager and, like, we can see, like, if we can do that next month. If we can't, we can definitely find another way to get there. But if you can, that'll be great, because clearly there is a lot of curiosity about that.
Yeah.
And I guess if you can take a stab at it, that'll be great.
Yeah, I can certainly. I don't mind taking a stab at it. If it's something that I can't
Yeah.
do, I'll certainly circle back with you guys and say that I can't. But I think I can at least come up with an estimate and give you an idea.
Yeah, an estimate will be fair enough. That's what I was getting at.
But at the end of the day, I guess everyone needs to know that we are covered.
Yeah, we are
That we
covered.
are happy.
We are covered, and I think,
so
you know,
things
you
are
wanna
going
just-
well, and we have a plan in place. And
Yeah.
so, yeah, it was
Yeah.
just some curious questions.
And it's a good question. It's a tough one to answer. But I think, you know, you kind of want to know, like, what is the general rule? And so what would you be looking for? Do you want to see, like, 90% captured calls, like 80%? If you tell me a threshold, I can give you.
So let me say something. I'll go off a number you have here. You
Yep.
have the 91% number here, if I remember correctly, right?
Yep.
You answer 91% of your calls on
On-time performance for hot
on-time
responses.
performance, right?
Yep.
Why don't we go off of that number, like, and
Sure.
try to work off of that number? Because I don't know if Kim has that number. I don't remember, Kim, if you have it in your
I
deck.
think they do. They
But
have their
you have
average
that number,
response.
I know.
Yeah.
Yeah. So, like, no, she has the hot and cold one, I'm sure. But I'm not sure, like if it is broken down like that as a percentage of the total calls.
Sure.
Yeah. But if you do that, it doesn't matter. I'm just thinking a kind of a common denominator somewhere, right? Like, we can go off of those numbers essentially.
Sure. Absolutely.
Okay. Yeah. Bill, you had a question.
So again, so circling back to this question of, you know, what resources do we need? The question really is, what resources do we need to accomplish X?
Right.
We have these data points for hot response times and cold response times, typically 7 minutes and 9 minutes. Where do those figures come from? Is 7%, is that a benchmark based on medical data that an average 911 call, you know, we need to get we need to get responsive personnel on the scene for the average medical emergency in 7 minutes based on something like that?
Yeah, so that's based off of, so it's out of the town EMS report, or EMS plan, excuse me. That's what we based it off of. So, but the 7 minutes was not just like it wasn't just like a whimsical number. It does come back to like an average response time that I believe, and I'm going to get the body wrong, but there is a federal body that recommends this is what the, you know, in a urban or rural, like kind of suburban area, they have kind of benchmarks for what your hot response time should be. There's a little bit of a de-emphasis on the cold responses because they're really trying to emphasize kind of driver safety and not taking unnecessary, you know, driving with due regard. But that's where that number comes from, and I can find out for you. I just don't want to say it body and be wrong with.
No, I
with
understand. I just wanted to confirm that number is not just what it is,
Yeah.
but it's what it should be. That this is
You're
that
correct.
there's a target number here. The 7 minutes comes from somewhere, based on, again, real data. I assume medically driven data about the average, if there is such a thing, emergency medical call. Yeah, every minute counts. 7 minutes is a figure that balances good likelihood of good outcomes with what's
Right.
realistic, as opposed to us, we've always done 7 minutes because that's what we do.
Yeah, and I
think you're telling me
hate to
that-
tell you
tell me
that there's something, but I hate to tell you, but I think the dirty secret is that it probably is a little bit of a ambiguous 7, that nobody really has a dynamite number. So the dawn of EMS, and I won't sidetrack us too much, they came up with this golden hour thing. You have 60 minutes for trauma to get to the hospital, survive. Completely made up. Like, that was a thing back in the 60s they made up to kind of push EMS's agenda. But I will find out and get some information. I can at least say this pretty confidently. We use that 7 minutes across all of our services. I think ASM covers some more rural towns, and I think it goes up to 10 out there, but I'm not 100% on that. But at least for the suburban, this kind of being in close proximity to a major city, we hold that 7 minute.
So this is not an example of towns figuring it out on their own. I mean, circling back to what the mayor said, I mean, how can each town be required to come up with their own? That doesn't. There's got to be, broader information out there. And your understanding is the 7 minutes. It's a sort of an industry standard, so to speak.
Correct.
For a suburban
Correct.
community like Rocky Hill.
Yeah.
Okay. Thanks.
I guess, unless there are any other questions, I don't have any, but we have some follow-ups. We can take them on next month.
And Dave, if we could talk afterwards.
Yeah, no, absolutely. That was good. I just want to publicly recognize one of my paramedics. He's going to be leaving us for LifeStar. Very bummed about it. Dave Rivera.
Yeah. That's
He's
congratulations.
awesome. Yeah, he started off as an EMT with us back in 2018, and he's kind of worked his way all the way up to the LifeStar program. So we're bummed to be losing him as a full-time employee. He is staying on with us. But we're super excited and wishing him all the best. So I just want to publicly just recognize him and get that out there, because it's cool. It's a really cool accomplishment to see him do that. So other than that, any other questions?
You really want more?
I'm good. I'm ready. I'm all fired up now. We can go all day. But I think you'll have another meeting coming up, so I don't want to hold you up too long.
Exactly. I want to be mindful of that, but I think this was a great discussion and to be continued. So thank you, Dave.
Thank you.
Thank you, Kim. And moving on to police.
Good evening. Lieutenant Gutsfeld, I'm covering for Chief Klett this evening. For calls for service for January, we have 2,749 calls. We have 26 criminal arrests, 4 DUI arrests. Let's see, 27 motor vehicle accidents, and 27 infractions issued, and 3 town tickets issued. We currently have 3 active background investigations for a certified police officer, 1 active background investigation for public safety dispatcher. Our animal control officer, we had 0 applicants received for that position. We are 10 days in both certified and entry level. Job announcements will be closing. We'll be moving on to oral boards from that point forward. Promotional exams, we have our actual promotional exam is taking place tomorrow, so we have several individuals that are been stressing out and studying hard for this test, and that test is tomorrow morning, so good luck to all the applicants on that. For support services and administrative requests, this covers, with our body cams, we had 15 cases that required digital reactions, which is a total of 26 hours to take care of that. So that's a very time-consuming type of thing going on there. Our SROs, we have a Friday football where our newly appointed SRO officer, William Jordan, has time with the kids at Moser School, and they play like touch football and get some of the other officers involved. And I think the kids enjoy it, but I think the officers are having a heck of a lot more time, fun with that. So, major investigations that we've had in January. I'm sure you're aware of the Kobe Road shots fired call that came from a residence. We're still investigating that with the detective division. And the Cumberland Farms robbery, I'm happy to say that our detective division, in working with 9 other agencies, were able to ID some suspects, and some warrants will be forthcoming in the future. So that's my report. Any questions?
Councilor Sullivan.
No questions. Thank you for the report.
Councilor Wheel.
Just on the digital information you guys are getting requests for, who's requesting that? You know?
We get from the courts, which we don't have to really redact anything because it's for the court use, but a lot of private citizens and stuff like that, that we have to basically blur out juveniles, people who are involved in the case, certain information, especially domestic violence information, suspect information. Depending on the cause, certain things have to be redacted so that it fits our FOIA request.
Thank you. Just one other thing, if you could relate to the chief, obviously with these promotions, it's gonna be a huge change in your agency. Please relay them, pick true leaders, not just yes people. You know, you want a little controversy, you want a little challenges within your agency, and I'm sure he'll do the best he can with what applicants you have. Good luck to everybody.
Madam Mayor, any questions?
So just going back to like the public policy committees, one of the laws that they're looking to pass, one of the bills they're looking to pass into law, I should say, is on regionalism, right? And so rather than forcing municipalities into regionalized efforts, they're going to give municipalities opportunities to work with CROG and sign these interlocal agreements. And one of the topics that consistently comes up is animal control. Do you see that as an area for our town where it's beneficial to collaborate?
I think, from speaking with Chief Klett, I think he had looked into that and didn't see that that was a feasible option. He thinks us having our own would be better. As I know that we get calls over the weekend and throughout the week where we have to call our part-time ACO in to cover that. And I think we can provide a better service and better coverage if we have somebody permanent assigned to Rocky Hill.
No, it's good feedback. Thank you. That's it.
Thank you. Actually, I do have a question on kind of piggybacking on what the mayor was asking. There are 0 applications for that open position right now. I was seeing your, the slide, right? And is that normal? Is there like is that something you expect to have 0 applications? Because it goes to the question of what the mayor was asking, right? Like kind of if you can regionalize this, if there is less interest in these kind of positions.
I know that Chief Klett has been in talks with Mona and Ray regarding that, so they may have better answers for you than that. I don't have anything. The chief would have to answer that question.
Okay, another follow-up, I guess, for next
I
one.
think that the issue might be, as in many positions, everywhere is the part-time versus full-time. And I think it's difficult to find a part-timer who's a professional and wants to put in, they're looking for full-time work, I think. We did have an opportunity through CROG for a regional ACO back in 2022, I think, the summer of 22. The chief then, Custer, also did not think it was a good idea to go regionally. So, that carries forward today. So, but we can look into it. I mean, if we have an opportunity, if we can't get anybody, we may as well capitalize.
Yeah, that's why I was going off of that even before. Yeah,
I
Councilor
agree.
Gideon.
If we can't get anybody, maybe the regional is another option that we could use.
Yeah. Actually, I want to go back to the Kobe Road shots, like in the investigation there. I know it's with the detective. Like, is there any prior incident like that has occurred in that facility?
That facility, well, this appears to come from a private residence. And looking through town ordinance, there's no town ordinance that has any coverage saying that the only firearms town ordinance has to do with airsoft guns. So there's no other town ordinance regarding firearms at this time. As for...
Can I ask you a clarification? Is that a fully residential facility? Like there's nothing...
This is someone's house with property.
Okay.
This is a private residence.
Yeah,
that has-
just for my clarification, I was not sure like how would you characterize? So it is a residential unit. Okay.
And looking through state law, there's no state law saying that they can't do it either. So that's where the problem lies, is there's no specific thing that we can find. It comes down to truly being an accident at this point. There was no intent to do any harm or anything, and that's where we're at with the investigation right now. But there's other things that are coming out during this investigation that are unrelated to the shooting that we're investigating as well.
Yeah, so about the town ordinances and things like that, like is there anything, because this is I can assure you I got like at least 3 emails on this. And over the last couple of months, just saying like, where is this? And that's why I wanted to like kind of focus on this today. Is there anything that can be done to prevent anything like this from happening going forward with town ordinances, and I'm not suggesting we have a town ordinance about something. We don't want to like just.
Right.
I don't want to suggest a solution just to look like we are doing something, but I think this should be a conversation at least, because I do think like it's spooked enough people, including myself, that I think it deserves a conversation. I don't know like if you have any constructive solutions for this, preventative
I know
solutions.
as a hunter myself that you cannot fire a firearm within 500 feet of a dwelling. So there's that law in place for hunting, but for shooting on your own property, I would say that the same law would apply, but I don't know. I mean, it's worth a conversation to maybe, there is something that a town ordinance could be put into effect that you have to have something, but again, I don't know the answer.
Yeah, so the current law, like, can it be enforced, like the one you were talking about?
That's for hunting, and this is this individual's own property, so there's some leeway when it's your own property. But the backdrop is what the issue was, because the round exceeded the backdrop, and we believe is what caused the round to go where it went.
Okay, so okay, I don't want to like get into the middle of your investigation, but I was just trying to figure out if this was an isolated incident we don't need to worry about going forward because there was a breach of law in some way, shape, or form, and we can fix that, or it will be mitigated through some actions, or this individual will be like, essentially, I don't want to say like, penalize anything, but is this something which we can look at this case and say, hey, is this something we should be doing something about?
Well, I think the fact that it came to light, we addressed it, we spoke with the property owner, we pointed out the possibility that there was an error with a backdrop situation where they didn't have proper backdrop. I think that resolved the issue there. I think this was an isolated incident, and because this is the first time it's ever happened, obviously. But the same homeowner is saying that from the Berlin range, they get rounds into their neighborhood or in their yard as well. But that's an issue they have to take up with the range. We have to worry about this individual shooting in his own yard and preventing this happening again. So I think that the proper thing is proper backstop for where he's shooting, make sure it's not going in a direction where it's unsafe.
Exactly. Councilor Sullivan, you
Yeah.
have something to say.
Yeah, so just picking up on that, so for example, there's an allusion to, are there any ordinances on this? We have them for hunting, or was that a statute or is that town ordinance with the 500-foot rule on hunting?
That's state law.
It's a state statute, but there's no counterpart, it sounds like, for shooting on your own property. But is there some type of standard out there, or maybe a statute ordinance elsewhere? For example, if you want to target shoot in your backyard, the backdrop shall be built with this type of material to this type of height, those sort of things, because we're saying the backdrop was insufficient. Well, okay, but we know that because he missed, but are there standards out there that perhaps could go into the ordinance saying that if you want to have a backyard shooting range, here's how to do it safely?
That may be something that the town may have to look into on their own.
We can look into that.
Yeah, I would really like to look into this, Ray, and I think I think those are the kind of things which I think we should look at from a problem-solving perspective, not just we want to, again, look like we are doing something just for the look of, for the sake of looking like doing something. And I would not suggest anything like if there's an existing state law or like an ordinance which can take care of this, that's fine. But it seems like pretty incredible to me that we are in this densely populated area and somebody can make a mistake like that and create a whole lot of, public safety issues for other people, other residents. I mean, it's incredible to me. We are not living in a rural community.
Right.
We are living next to each other at 20,000 people and in a pretty dense neighborhood, I would say. I mean, right? I mean, so I think if there is a unanimous, agreement here, like kind of to look into this in the near future, that'll be great. So
Yeah, I'll talk
thank you, Ray.
I'll talk to the
Thank you
chief.
so much.
I'll talk to the chief.
All right, so moving on to our last report of the day, moving on to Charlie Brown and the Health District, who is remotely attending the meeting. It's online.
Hello, everyone. Just being good public health professional that I am, a little bit under the weather, so definitely pulling some remote. Right now, the numbers total for COVID are really down, I think, overall. Where we're seeing increases or continued high numbers is in our respiratory disease, our influenza-like illnesses. For the past 4 months, we've been over our 5-year trend line. And as EMS has reported, there's been a lot of, I think, respiratory disease out there in the community. So just want to make sure that we're doing the right things for prevention. Once again, wash your hands, cover your cough, stay home if you're sick, or stay away from individuals if you have to report to a presentation. That's my story, and I'm sticking to it.
Thank you, Charlie. Any questions?
No questions.
Questions, Councilor? Charlie, I think you get to go home early today, so.
No,
no question.
because I have to go to the town council and present at 7.
Well, you get a dinner break, which we don't, but you do. But thank you,
thank
thanks
you,
for
guys.
your report.
Feel better.
Thank you so much. Yeah, feel better, please.
Thank you, guys.
So moving on to old business, I don't think we have any new business. I don't think we have any new business. We don't have any other business, so I will entertain a motion for adjournment.
So moved.
Second?
All in favor?
Aye.
Aye.